All right. Well, welcome everyone. Thank you so much for joining our October Behavioral Health Advisory Group meeting. We are all very glad that you are here today, and we are looking forward to another great discussion. So, as folks have already started to do, if you'd like to introduce yourself in the chat with your name, your organization, and then we have a mindful minute. Our question this month is, what is one self-care practice you enjoy during the fall? And if anyone is new joining us today, if you'd like to come off of mute and introduce yourself.
Hello, my name is Denise Albright. I am a program manager within the health department and specifically under the Behavior Health Division and Youth and Prevention Initiatives. Thanks for having me, Taylor.
Absolutely. Thank you for joining us, Denise. All right. Anyone else?
I'm not new, but it's been a while. Amber Allen, Prevention Link Program Evaluator with the Health Department, Office of Assessment and Planning.
And Amber, I'm going to pick on you. What is your self-care practice that you're enjoying this fall?
I've been trying to get a good journal streak going. And I am partial to the cool fall weather, so trying to get out more than I did over the summer when I was bunkered down with my air conditioning.
Very nice. Thank you very much. Anyone else? All right. Well, to get us started today, Denise is joining us from the Behavioral Health Division. So she's going to be giving us a short presentation on an ongoing initiative and to keep the BHAG informed and see some next steps that we could get involved in. We'll open up a short time for some questions and answers if anyone has any feedback for Denise. And then we will go into an exploration of Findhelp, community resource inventory. I'm seeing some familiar faces who are also engaged in our community care coordination team. This is an initiative that work group has especially spearheaded, and we want to make sure that we are involving all of our behavioral health partners and adding their resources and just making sure that we are building a more cohesive resource inventory that is inclusive of you all, of all of your programs, of all of your organizations, to make sure that community residents and community health workers can be able to access all of the behavioral health resources that exist within Prince George's County. Then we will end our meeting as usual with community announcements and upcoming meetings. And so just to ground us, a few objectives for our meeting, our discussion today. So first, as I mentioned, we're going to discuss how the work group can align and support the Behavioral Health Division's asset mapping initiative. Again, this is all an effort to create a more comprehensive and accurate resource inventory of behavioral health resources in Prince George's County. We know that there are several resources that exist out there and in an initiative to make sure that we are investing in one resource that is as complete and as accurate and as up to date as possible. We want to make sure that we're getting out this information about this ongoing effort that exists with Findhelp and hopefully get some more feedback as we get further into this process as to some of the questions and some of the concerns that may exist for our community partners who would be the audience of focus for this initiative. And then we are going to discuss changing landscape. So again, I mentioned there are several behavioral health resources out there that exist, and we want to make sure that we are communicating about changes to the existing ones that we have within our PG Health Zone. Within that website, we have the behavioral health provider list. There will be some upcoming changes to that website, so I just wanted to provide you all with an update there. And then again, this ongoing initiative to add your resources and claim your resources in Findhelp. And so to get us started, I am going to pass the microphone over to Denise, who is a program manager with Prevention and Youth Initiatives here at the Prince George's County Health Department. Thank you so much for joining us today, Denise.
Thanks a million, and thank you to everyone for joining as well. I'm going to do my best to present here in Teams. And Taylor, if you could just let me know once it's viewable from your end.
Absolutely.
Okay, I'm pressing present. All right, are you able to see it?
Yes, we are.
Okay, perfect, perfect. All right, again, thank you everyone for having me. Our health department is engaged in a development of a strategic plan for the entire health department. Separately from that, and a little bit ahead of the overall health department strategic plan, is the Behavioral Health Division strategic plan. The Behavioral Health Division strategic plan is separate and has been completed. And now we're in sort of that second phase of working towards implementing it. And as we implement it, I have been charged with leading the priority number 7 of a total of 7 priorities within that strategic plan. And within that priority number 7, our job is to improve our overall approach to substance use and opioid use disorder through a data-driven response and partnership collaboration. Before I go any further, we always like to ensure that we're sharing our vision, mission, and value statements. And in terms of our vision statement, all Prince Georgians are the healthiest at every age and every stage. Our mission and what we're trying to do here today as well is to lead, engage, and empower our community to work collaboratively towards disease prevention, health equity, and total well-being. And we do that through our beloved value statements that include equity, diversity, and inclusivity, respect, teamwork, accountability, innovation, and excellence as well. All right. And so with that being said, again, we're working towards improving our overall approach and with the overall goal to reduce overdoses, both fatal and non-fatal, in Prince George's County. And in order to do that, we have to start to break some things down into some sub-goals. As I stated before, we just embarked on starting to implement our behavioral health strategic plan. And that sub-goal needed is to determine a mechanism and align with partners to share our valuable substance use and opioid use disorder resources with providers, navigators, the community, so it can allow us greater access and communication for both prevention and treatment services in our county. So as we're doing this, we've been meeting with a smaller group so that we can sort of address how this will roll out. And so at the moment, and through a series of meetings, we have examined the public health, the behavioral health resource landscape in Prince George's County. And so what you'll see here is some of the resources that we've taken a look at. And if you'll notice that we all have resources to support behavioral health, but they're not all synchronized. They're not all in one place. And we need a central hub for that. And we need one that will be reliable, sustainable, and ongoing so that we can promote to the public, our community, as well as our partners, and then also ensure that our providers are aware of this as well. And so we took a look at all of these, determined who managed them, what was the purpose of those, and how user-friendly were those. And then as a result of that, we decided to move forward with updating and working with Findhelp. This is a sustainable resource. It's a primary mechanism that we can use to share and access our behavioral health specific resources, as well as other resources in the county as well. So if somebody comes in and they need additional supports to address barriers, we can utilize Findhelp to support that effort. Findhelp also, as a social care network, it connects people to programs. It can be mapped by zip code, and the population, our community already utilizes this. And it provides resources across multiple areas, including food, housing, goods, transit, any financial support or education or other legal service barriers as well. Looks like I got a small typo there next. But again, we can map it by zip code. And it can be integrated into the electronic health record through Epic. And we have been able to see proof of this. I'm happy to see you on board, Amber, because you probably are very much aware of this. But we've been able to integrate this as proven through Epic with our Health and Wellness Division's Prevention Link program. And in that program, our community health workers essentially complete a full assessment, uses Findhelp through Epic to connect patients to resources through referrals, and it'll include bidirectional communication so that we're closing or including that feedback loop for better care coordination. The other great thing about Findhelp is that the coverage of the cost to do so are already built into the existing agreements, as you are aware of. And we have intentions to expand if we can get additional providers into Findhelp. All right, I'm gonna make sure you're transitioning the way I'm transitioning on my screen. Doesn't look like it's moving. Okay. So here's a screenshot of Findhelp and what it will look like as individuals go in, either from the community and or from the provider's perspective and or navigator. If someone goes in and is seen for a need in, let's say, bridges to access, bridges to access, and they have a barrier, and or we can identify, hey, they need a community resource to support them. We can identify the resource that they need by category, by zip code, and then also go in and figure out how to address a barrier. Maybe there's a transportation barrier. Maybe that's why they couldn't get to one of their appointments. Well, we could utilize Findhelp. Here at the very top, you'll see each of the tabs. And the tabs really take a look at the food, the housing, the goods, transit, health, care, education, work, legal, and even financial assistance if needed. And so if we can build this in, this would be a really great move to help support everyone in the care continuum. So our next steps in terms of moving forward, we've started to determine the resources that we need to explore to ensure that they're available within Findhelp, but this is where we need your assistance. We are already planning to review and ensure LBHA providers are updated into Findhelp. There's a list there that we also have harm reduction resources in there, including naloxone, syringe replacement centers and services, bridge center partners, as well as needing your support more towards the right side here to download a list of behavioral health resources, right? Confirm if any are missing, and then ensure that they get integrated into Findhelp and migrate any resources from another one of those others that I showed earlier into Findhelp, just ensuring that the resources themselves take accountability and own sort of their own display on Findhelp. So we want to make sure that they're verified and updated. And then a part of that is ensuring that that organization is accountable for doing that. We want to ensure that community-based organizations, even faith-based organizations that offer prevention and treatment services can also be found in Findhelp. Programs that offer pre-crisis and even post-crisis support. I think we oftentimes think of exactly what's happening in the moment, but there are things that we can do to prevent. There's also things that we can do afterward to ensure that we're providing that whole comprehensive service to each individual in need. There are also centers that offer specialty programs. So we want to break this down just as Findhelp does through youth and seniors and veterans, those that are unhoused, and then those with services to address substance use and opioid use disorder as a whole. Oh, sorry, my screen is not participating with me today. All right. And so as we move into 2025, the pathway is becoming more and more clear as we sit and work with our partners. And that is, we need to ensure that our partners are aligned in Findhelp, right? To ensure support and access to care, and that we're addressing barriers to care. We want to work with our internal partners initially to integrate and ensure that they're able to see and use Findhelp within Epic and through their EHR to refer. We want to establish bidirectional communication between our providers and referring partners, and then ultimately begin to expand this outward so that additional partners can be integrated as well and included through MOU agreements. This in all will promote a single resource in findhelp.org versus multiple. It will ensure that EHRs have quick access to resources and then ensure a feedback loop between providers and a referral source. This is essentially our first phase and what we really want to do and begin to really expand this outward so that the entire county can benefit from such a resource and availability of such a resource. And Taylor, I think I will end there. I know I've given you guys a mouthful, so I'm certainly here to answer any questions. And just remembering that we are in the very beginning stages of this. And so we are working really well together in terms of partnerships and those at the table. But I do want to get your feedback to listen to see if you already have some experience in this and or if you have any other questions or additional feedback to help support. Larry, it looks like you have a question.
Oh, yes. Thank you so much, Denise. I think this is a really great idea. But let me just ask you two questions about it. I know a couple years ago we had a similar undertaking with a platform called Unite Us, and I was sort of, had this similar concept to this, and I don't know why that kind of it didn't seem to work out and I'm not really sure why. I'd never heard anything further about it. And then I think one of the issues with these systems, which I think the tech people call closed loop referral systems, is that the providers all have to provide data entry into the system and in order for it to work properly so that there's really two-way communication. And I think the problem sometimes can be, unless there's a way to like pay the agency something for that data entry, my experience is a lot of times that data entry that you need for that success of the two-way communication doesn't happen. So I just wanted to throw those two out.
Yeah, thank you for that. In terms of Unite Us, I'm not exactly sure why that didn't work out either. It may have been, unfortunately, before my time here. However, in terms of paying for entry into something, it's something that we are going to have to explore. We have the possibility of utilizing additional funds from our opioid use or opioid abatement funds that are coming to the state. And so ultimately, again, we'll have to establish some agreements, right? These are data sharing agreements, MOUs that need to be put in place so that we can exchange this sort of data. And we're working also in a parallel stream in the background to work through some of our abatement funds to support initially an internal dashboard to be able to get that sort of set up so we can track some of these metrics. But ultimately, if there is a need in terms of identifying resources to support this from the external face of this, then that's something that we're going to have to explore. Any other questions or thoughts? Amber, you are working with Prevention League as their evaluator. I'd love to be able to get to chat with you at some point to kind of figure out what sort of metrics you're utilizing. We actually, I know I did a very brief sort of overview here, but we actually got this idea from Prevention League, where Prevention League is already being utilized within our health and wellness division with the work through their community health workers, and it seems to be working well. And so we wanted to align this within the behavioral health division as well, which will, I think, even strengthen what's being done throughout the health department and definitely fortify this. And if we can all sort of get on one track here, it definitely would fortify this. Amber, I wonder if you had any additional thoughts.
At least
I'm sorry to put you on the spot.
no worries. At least for the Epic integration, we're still in the really early stages of that. Like I personally don't have an Epic account yet. But it is really promising, and we do have an Epic presentation to other CDC recipients coming up at the end of this month. So we could share the information for that potentially. I think it should be open to everyone. I'll double check and share with Taylor if it is.
Well, thank you. I think this is, again, based on our discussions with our groups, our meeting groups about this and the possibility of gaining some support from the BHAG, it's so that we can ensure that our lists are up to date and we're all working from the same resource list. I think will really be critical to this overall function. Again, we're in the very early stages. We expect things to evolve over time, and we'll be fixing things as we move through. But the idea is to work towards a more effective approach to addressing our opioid and substance use disorders in the county. All right. Well, thank you, Taylor. I really appreciate the opportunity.
Thank you, Denise. Appreciate you presenting today. And as I mentioned, our Community Care Coordination Team, our CCCT, is another work group within the coalition that is really leading the effort to build out the resource inventory, to get folks aware of it, to increase awareness, leading that campaign. So really looking forward to partnering with the Behavioral Health Division to roll this out and hopefully bring in our other partners from Healthy Eating, Active Living. I know we have a housing partner. Jay's on the line here. And we've had past presentations, like Amber had mentioned, with Prevention Link team with the integration of Epic. And we've also had some meetings where we've discussed the integration of CRISP. So I'll be sure to send out those meeting recordings for anyone who's interested in seeing how does this system, how does Findhelp, how does it integrate with Findhelp or with Epic and CRISP, and how can those bidirectional feedback loops occur together.
Thank you.
Great. Let me go ahead. Share this. All right. And so just in getting some feedback, as Denise mentioned, as we're nearing the end of the year, we wanted to hold this meeting to give everyone context as to some initiatives that are going on in the background, but also will have some impact on the BHAG. And so we wanted to get this all in front of you before we break for the end of the year, and be sure that we got your feedback, that you all were aware of this, that you had the context. So as we build this initiative out in the new year, that we are able to get up and running and hopefully be able to engage partners who aren't currently at the table, but again, to make sure that that resource inventory is as comprehensive and as accurate as possible. And so with that, I just wanted to get some more feedback from members who we have on the call today. So if folks wouldn't mind, if your organization is currently listed in an online resource inventory, can you share which one? How did you come to that decision to have your organization listed in that online resource inventory? What is that process like? Do you go through and you validate information on a regular basis, or what does that look like for you all? And I have some example inventories that folks may have previously used. So the network of care, our resource inventory, again, that I mentioned on the Prince George's County Health Zone, our website here, the Behavioral Health Services, LBHA's resource inventory, and then, of course, Findhelp. Does anyone currently know if their programs or organizations are listed in any of these inventories? Or does anyone currently use any of these resource inventories to locate resources for clients or? Okay, so maybe not. And maybe that shows us our need to make sure that folks are set up and Findhelp. Okay. All right. And then last question, and I think this relates back to what Larry was mentioning with Unite Us. So Unite Us is used in Virginia. And so curious for the groups here, we have a lot of organizations on the call who your services aren't just focused on Prince George's County. You may work in some of the surrounding jurisdictions. So Montgomery County, Howard County, you may expand resources to DC or Virginia. So just curious if folks are using any jurisdiction adjacent community resource inventories, such as Link U is used in DC, the CARE app that's used in Howard County, or Unite Us in Virginia. All right.
And I wonder if I could ask just a quick question, and that is how do most, and I know it falls right in line with this, but just stating it another way, how do most folk promote their services? Through what mechanisms? I know word of mouth has a lot to do with it. And Ms. Maxwell, I think I've seen the Black Mental Health Alliance in a couple of places, but I'm not sure if that's you're doing or if others are picking it up and promoting them.
Miss Cheryl may have some tech issues.
Okay, yeah.
Miss Cheryl, we are not hearing you if you're trying to talk.
Oh, through community events. I see in someone, Ms. Coker now is saying that. Yeah, that makes sense.
See, but my program is in the jail though. So I'm inside the jail. So whenever we can, we collaborate with the Bridge Center at Adams House. So we utilize their services quite a bit. And we actually spread their flyers across the board. So I'm not sure how else other people are doing it, but the health department assists with getting our information across and vice versa.
And Miss Cheryl, I believe in last week's CCCT call, you mentioned that your organization, you guys are in Findhelp, but your organization isn't claimed yet. And you are still muted.
Okay, Taylor, my gracious, finally. All right, the question, yes, we are in several listings, but for the moment, or at the moment, I can't recall off the top of my head which they are, but at least there's one or two you said that you had seen our listing. And then the challenge with the with our technology today. I apologize that there was the delayed response to your question. Did you ask me something else? I'm right now.
Not only that, I was wondering how you as an organization promote your services.
Primarily, I heard someone say earlier, word of mouth, which is one of the best sources. Our website, primarily the events and activities that we have are also promotions for upcoming activities as well as the services that we provide. But I believe perhaps our website gets the largest number of inquiries or generates the largest number of inquiries.
Excellent. Thank you so much.
Mm-hmm.
I'm just looking through some others on the call. Miss Angela from MPP Group, do you have any ways that you get out your program's information, or is a resource inventory something that would be valuable to your organization?
Hi, Taylor. Can you hear me okay?
Yes, we can.
So I'm not sure, to be honest. I was thinking about this. I actually reached out to our program director because I'm not sure if we're actually involved in any of these resource inventories. So I'm going to actually look into that and see. But at the moment, I'm not sure, to be honest.
Gotcha. Thank you.
Mhm.
Great. Any other folks have any other comments that they'd like to make, or any other considerations, again, as we consider what this rollout of Findhelp will look like and engaging partner organizations? Does anyone have any additional questions or any concerns, or would they like to hear more about Findhelp?
Oh yeah, I just have 2 points. One, you brought up a really great question about some of these. I don't know what to call, maybe search engines or resource sites. I mean, I know I was on Info Montgomery's work group for a number of years, and I think one of the problems is if unless there's a conscientious person who updates these lists, what I found is that there are programs listed that no longer exist, names that change that aren't updated. So I guess maybe that's in support of your idea that maybe there's one system that the county is sort of overseeing to make sure it's an accurate resource. The other thing is also when you're talking about integrating with an electronic health record, I mean, I don't know their process, but I know usually that there's a cost to that and labor involved in that. And you might have to find out how much it would cost organizations to integrate Findhelp, into their EHR to make sure it's not cost prohibitive, because I've tried to do some integrations with a system I'm using, and I found like sometimes they can be like $5,000 to integrate one system with another. So it's not like a trivial cost. So I just wanted to mention those things.
I,
Thank you for that. Ms. Cheryl?
yeah, I have to add, I've heard more than once in someone's comments about the fact that you get this information, you got it in one central place, but the information changes so quickly. It's always fluid. And we've had an experience. We went through the age of CRISP. We went through the situations where they began to pull it together. Then they found that there were some issues with HIPAA, and some other things came up and it kind of fell all apart. So I don't want to be doom and gloom, but I do want to ask the question, is Findhelp looking at some of the experiences of other efforts such as this, particularly those that kind of disintegrated, to see what they can prevent in the way of pitfalls?
Yeah, thank you, Cheryl, and Larry as well. Thank you for both of your comments. And Ms. Collier, I see you there for a moment. I'm going to take the first stab at this. I know you probably have some thoughts as well. So with that being said, yes, this is something that we're not just going to roll out in its full phase completely. Initially, we're going to start with something smaller, make sure that we sort of work through all of those little kinks and things like that, make sure we have some data sharing agreements in place, all of those kinds of things, kind of get all of that set up. We'll be working with Findhelp to help us understand what next steps are needed. We have both Findhelp and others like Epic already on board, so we can work through some of these things initially. Again, this is evolving, right? We don't claim to know all the answers up front. However, we are going to be working through that with a full team, and also be bringing things back to get your feedback, your your guidance on some of these things as well. I think at this point right now, there's just so much out there in terms of resource lists everywhere. Yes, there is a concern about sustainability, about keeping these things updated. However, I think that's one of the more positive things about Findhelp, in that there is a checkbox where it says this has been verified. And if we can get organizations who are added to Findhelp to sort of own their organization whenever there's an update that needs to be made, that if they own it, they can reach out and say, hey, we need to update this information, right? And or perhaps we work down the line to continue to build this out and say, hey, okay, maybe we need to reach out to this core list or this list of individuals or organizations that are listed in Findhelp and say, hey, do you need to update anything? Do we need to send out reminders to do so? And then also continue to work with Findhelp to ensure that we have those verified checks in that system as well. I hope that helped to answer some of that question. Deborah, you had a question as well, or maybe a comment.
No, I was just going to echo everything you mentioned, and just to simply say, I think that's what Findhelp is encouraging people to do is find their organizations if they're already listed on Findhelp, is to go in and take ownership of those, and then some of that maintenance piece that you're mentioning will be alleviated with that piece. Essentially, asking the organizations to kind of be responsible or take ownership of updating their information as it's changing, because I do think that, I don't think anyone would disagree with any of the comments that you all have made, that it probably is a daunting process to keep up with all the ever changing names, organizational structures, all the things that can happen with an organization within one county. So, I think that's the primary reason why they're asking for organizations to take ownership of, if they're already listed on there, to take ownership of their organization, and then if they're not, to kind of onboard them in that way. And Taylor, you can, if I'm saying anything, I think that's kind of the idea behind it.
Yes, you're exactly right, Deborah. So again, it's a two-step process. It's both adding your organization to Findhelp, but then also claiming it. So claiming means that you have an administrator in your organization who can go in and can take over the login information and would be responsible for adding your organization's hours. Who do you serve? What are specific criteria? If you only serve populations in specific income bands, if you are focused on any subpopulations in Prince George's County, if you have any intake forms, if you have any forms that folks need to fill out ahead of time, there's capacity where all of that can be held in Findhelp. And again, that would come through that claiming process. And another reason why the efforts have been put into making sure that Findhelp is updated. Findhelp also goes through the process every 6 months of making sure that organizations are updated in the system. So it takes the capacity off of all of the organizations who are on this call. So, for example, with PG Health Zone, we have the behavioral health list, provider list that is severely outdated, that has providers that haven't been active in years, or they don't have correct addresses or phone numbers that are no longer working. I know LBHA, they have a provider list. And so it takes away the burden for someone to sit and to have to validate all of the organizations and go through. It really helps to streamline the process. So again, we can be more so focused on engaging our other partners to make sure that their resources are available on Findhelp. And again, it's all timely information. This was something that we heard from our community health workers, that as soon as a list is printed or as soon as it's published, it's already outdated. And so they need something that's a constant revolving door. They need more standardized processes. And so we're hoping that Findhelp can be that avenue. And also to Larry's point, talking about those paid enterprise versions and the integration of CRISP and Epic. The CCCT, again, we're handling those requests on a case-by-case basis. We would be happy to talk with any organization one-on-one and see how we can get you all connected with Findhelp and get some specific calls to hear your needs and to see how the platform can best support your organization, and to see what features could you get on a free version, working up to that enterprise version. So hopefully that gives some additional context as to the next steps. a little bit more information about Findhelp's platform. And Ms. Cheryl, I see your hand.
I was thinking because I direct a resource and referral program, and of course, we have professionals from all across the country that we have in our database. And despite the fact that you do have conscientious organizations with conscientious staff, things change. Organizations change, staff changes. So I'm wondering if a part of your, how should I say this, a part of your way by which you determine whether organizations remain in Findhelp or not is by having some type of expiration date or a date by which, if they haven't verified that the information is still correct, then after a period they drop out. There's some way of being able to make the list somewhat self-cleansing, because despite the best intentions, we've got so much going on as organizations. You're going to put your information in Findhelp, and I can rest assured that within a year or even less, you may even forget that Findhelp is one of those that you've got your information with. And the question that you asked me initially points to that fact. I know the Black Mental Health Alliance is listed with at least 3 different resources, but I'm going to have to go back through my emails to find out who they are. So if there's some way to help generate a way by which the list can kind of be self-cleansing, which is what we're attempting to do with our resource and referral, that might be helpful too, to keep your list fresh and to keep it up to date and Findhelp. If that suggestion is at all helpful.
Cheryl, I want to say that is absolutely helpful. This is why we need to come and talk to you guys, right? So we get this type of feedback. That is wonderful to hear. And thank you so much for sharing that. Something as simple as an expiration date possibly could be a really big help here. So I have written that down. Taylor, I don't know if you have any direct information about potential expiration dates within Findhelp. But as we move forward, I will certainly bring that forward as a possible partial solution to help support this process. Thank you so much for that.
Yes, and I'll get some specific information about, again, that claiming process, and then as Ms. Cheryl mentioned, that self-cleansing process, those processes that are built into Findhelp to keep it updated, to keep the information accurate. I know that there's some work that Findhelp does in the back end, so I'll get some clarity on that information and get that all sent out to you all. So when you are having this discussion with members on your team, you can be as informed as possible and know that, the commitment that this is. And again, we're trying to remove the burden off of humans and the limited capacity that organizations have. And so we want to make sure that we're addressing all of these barriers as early as possible. So please continue letting us know if you have these concerns. Again, our community care coordination team, I'll put their information at the end. Anyone who's interested in continuing this care coordination conversation and talking about these resource inventories and, possible questions that we need to take back to Findhelp. And if you'd like to hear more about prevention links integration with Epic, please feel free to join that work group. I can also send meeting recordings. They're available on our PGC Health Zone, our website. We will be sure to get all of that information out to you all. And we're also learning from all of these jurisdictions. So as you see, I included a few jurisdictions who have very successful online resource inventories. Some are using the enterprise version of Findhelp, and others are using other inventories. But we're hoping to learn from those partners. We actually have a meeting tomorrow to discuss the CARE app. So we're going to be hearing some of those reflections and in some of the jurisdictions where they have had Findhelp around for a few years, and learning some of their lessons learned, what were some of their headaches, and how can we take all of that and implement it in Prince George's County and have some best practices. So certainly more is to come, but just wanted to give you all some context today and invite folks to further engage in the conversation if you are interested in doing so. So I'm just going to skip over that. And so again, as I mentioned at the beginning of the meeting, this is all very timely as we think through. Not sure if folks are familiar with the PGC Health Zone with that behavioral health provider list that we have on that website, but like I mentioned, that website, that list on the website is very outdated. And again, it relies on one person to go in and update information and to make sure that there is quality control in place and the processes just don't exist. And so we will be transitioning from the provider list to Findhelp. We'll be integrating Findhelp on the website. So folks will be able to go in, list their zip code, and find resources through Findhelp rather than this provider list. So that change won't be happening for a few months, but again, just wanted to put this on everyone's radar. In the event that your organization is in our provider list, we will be reaching out to you with steps and making sure that folks are as informed as possible about the transition to Findhelp and what it means for their organizations, and have the instructions to be able to make the transition as smoothly as possible. Any questions or any concerns based off of our previous discussion or based on this slide? All right, well, we will continue to update folks. And again, if your organization is listed on the provider list, we will be sure to be in contact with you, and I'm happy to engage in one-on-one meetings with any organization who has any particular questions or any concerns. And if you're interested in learning more about Findhelp and what it means for your organization and seeing how feasible it is for your organization or your specific programs, Findhelp does offer free training once a month. It is on the second Tuesday of the month from 3 to 4 p.m. I will be sure to include the registration link in the meeting notes, but anyone can attend. It's held virtually. It's a nationwide training. You can just come, have some questions answered, and they'll do a very general walkthrough. So I know some folks we have probably on the call have varying knowledge or experience with Findhelp. So please do feel free to utilize this free service to get any answers, any questions that you have answered, or to see the capabilities and all of the interesting tools that exist in Findhelp on the free version. And lastly, in the meeting notes, I will include the CCCT, again, one of our work groups. They have created, they're creating a media kit to be able to engage organizations and Findhelp. One of the first tools that they have created is an email template with Findhelp resources and instructions. So if folks are interested in continuing the discussion beyond today's meeting, I will share with you that email template. You can feel free to use the instructions that are included in that email template, or send it to any of the organizations that are in your network that you would like to have informed of this switch to Findhelp as well. Again, I'll include this in the meeting notes for folks to consider the top 5 organizations you regularly interact with and trying to engage them and Findhelp as we move forward. I know this will come up, especially as we continue to work with Denise in the Behavioral Health Division and making sure that we're all connecting with our networks and being able to get providers connected. And lastly, as I mentioned, the CCCT, mentioned them a lot throughout this meeting. This work group meets the 4th Thursday of the month at 11 a.m. And so again, a lot of their work is having to do with Findhelp. We're going to be learning from other jurisdictions about lessons learned. And so if you were interested in attending, their meeting is next Thursday, October 24th at 11 a.m. I will be sure to include the Teams meeting link in the meeting notes as well. And before we jump into any community announcements, do folks have any additional questions or comments they'd like to share? All right. And just jumping into a few community announcements. I see Dr. Latouche Howard has joined us today. This announcement came from her and her team with the Maryland Commission on Public Health. There's a survey on public health communications in the state of Maryland. The survey, we are asking folks to complete it by October 31st. So I will put the link here in the chat if folks are able to complete the survey. Again, the survey seeks information from individuals who live or work in Maryland to learn about selected sources that they've relied on for health information, excluding personal healthcare providers. So again, a really great survey that is happening to inform future public health practice as it relates to public health communication. And again, that deadline is October 31st for that survey. Next, the Prince George's County Board of Health held a panel discussion on the health impacts of domestic violence. The panel took place last Tuesday, so I have included in the chat the link to the panel recording for those who are interested. There are some next steps that were identified, an initiative that will hopefully come up more here in Prince George's County to address. And so for anyone who is interested in viewing that recording, hearing more about next steps, or particular ways to get involved with some partners, please do feel free to view that recording. Next upcoming on November 23rd, MedStar Southern Hospital is hosting their Senior Health and Wellness Fair. So if any of our partners on the call would like to participate in the Wellness Fair, I have included Jessica's contact information. Again, that's on November 23rd from 10 a.m. to 2 p.m. Something to keep on your radar as we go through the fall. We have a few upcoming trainings starting from November through December from our partners at Change the Conversation. They offer clinical trainings specifically for clinicians and mental health providers that work with those who are impacted by child sexual abuse and trauma. And so I put that link in the chat that you can go to and view their schedule and all of the trainings that are offered. Miss Cheryl, I see your hand. And you're still unmuted. You're
Oh, all right. And are they offering any CEUs, continuing education credits for any of their trainings?
I do believe so. Yes, I would take a look at that link here. And I know I saw some information for each training. Let me answer your question.
Thank you, ma'am.
Absolutely. And any community announcements or upcoming events folks would like to share while we're on the call?
I would like to share, Taylor. This is a wonderful platform to do so. So each year, as you know, there's a National Prescription Take Back Day event, and it's held twice a year, one in October and one in April. And this year it'll be held on October 26th. And so we are working to help support this event. It's a collaboration with the DEA, our local police or law enforcement, and our health department. We will be, and I can provide this information to you, Taylor, so you can provide in the notes. We'll be in Suitland at Pilgrimage Church this on October 26th, a Saturday from 10 a.m. to 2 p.m. and are promoting that individuals share this information as well as come out and drop off any unwanted, unused, or medication that you choose to discard of, including vape pens as well. So we'll be there, again, working with all of our partners as well as the law enforcement and the DEA to support this national event. Thank you.
Thank you, Denise. Any additional announcements? All right. Well, thank you everyone for your feedback and your attention today. We will convene next as a BHAG on Wednesday, November 20th at our usual time here on Teams. And just to pencil in on your calendar, the coalition will have its in-person quarterly meeting on Tuesday, December 10th. We'll get to hear some exciting updates as it relates to the department's strategic plan, our community health assessment, and all of the wonderful work that is happening across our other 3 work groups. And we promise to feed you. So it'll be a better time than just virtual land. So I will send out more details as they come in. But as always, please do reach out if you need anything in the meantime. But I look forward to seeing you all next month.
Thank you, Taylor.
Thank you, everyone.
Thank you.